Good afternoon. Good morning, good afternoon, and welcome to everyone, whenever in the world you are joining us from today. My name is 𝗃𝗵𝗀𝗲, and I am the GNC Nutrition, Climate, and Anticipatory Action Help Desk. And I'm really pleased to welcome you on behalf of the GNC Anticipatory Action and Nutrition Task Force to the second session of our webinar series on anticipatory action and nutrition. Next slide. So we have a very exciting agenda for today's session. I will start with a few introductory words to provide some background on the task force and this webinar series, as well as a couple of housekeeping notes. Then the session will unfold in two main parts. So the first part, in the first part, the GNC team will present the main achievement and lesson learned from the support provided over the past months to integrate nutrition into national anticipatory action processes in South Sudan and Yemen. Next, we will move into a high-level dialogue with national actors from both countries. After that, we will open the floor for a Q&A session, giving you the opportunity to ask questions and share comments. And finally, we will wrap up the webinar with a brief closing. Next slide. So let me introduce the Anticipatory Action and Nutrition Task Force. So this initiative was launched in July 2025 as a joint effort between the GNC Climate Crisis Working Group and the Nutrition Information System Working Group. As you know, anticipatory action has gained significant momentum over the past years and has even become a dedicated work stream within the humanitarian reset. So we therefore felt that it was timely and relevant to establish a dedicated group. Our goal with this working group is to drive concrete action aligned with country-level priorities by supporting tools development, sharing of country experiences, and learning. You can find more detail on the task force using the links that is provided on the slide. We have already some resources available, including an ongoing mapping of initiative and lesson learned, and a lesson learned brief jointly developed by GNC and ACF. And importantly, we also launched last December a webinar series on anticipatory action and nutrition. Next slide. So let me quickly remind you of the objectives of this webinar series. So through this series, we aim to explore good country practices and operational tools that already exist. These are concrete, real-world examples meant to inspire us and guide our collective work. Our second objective is to foster exchange on integrating anticipatory action into nutrition programming. This is about learning from one another and strengthening our approaches together. So we had our first webinar in December, and we had a great presentation from WFP colleagues on their new guidelines for anticipatory action and nutrition. We had also some insight from the Kenya country office, sharing their experience in activating anticipatory action for nutrition in 2025. Today, it is our second session, and we will delve into lesson learned from South Sudan and Yemen on implementing anticipatory action for nutrition in this high severity context. And I'm super happy also to share that the third session is already scheduled for the Humanitarian Network Partnership Week. It's going to take place on the 10th of March. It's going to be both online and in person, and we will circulate more details very soon. And finally, if you want to get involved and you want to share your experience or tools, please, we'd love to hear from you and contact us. you can go on the anticipatory action and nutrition task force to get our contact and send us emails. Next slide. Here are a few housekeeping rules for this webinar. So first, the webinar is being recorded. The recording, the slide, and other resources will be posted on the GNC website and shared with you all soon afterwards. Feel free to introduce yourself in the chat. You could put your name, who you are, your name, where you are listening in from, so that we know better who is online. Please keep your mics and cameras off during the session to save on bandwidth. You can put your question for the Q&A session in the Q&A box. It should be, so maybe not to the globe icon, but it should be on the bottom of your screen. During the Q&A session, you will have also the opportunity to ask your question directly to the panelist or speaker. For this, you will need to raise your hand. And finally, for any other general question or comment, please put them in the chat. And another point, important, is that the session is being is being translated in 3 languages, so English, Arabic, and French. So you can select your preferred language. For this, you need to go on interpretation. If you can't see it at the bottom of your screen, please click on the more and the 3 dots and then select interpretation and select your language. Finally, there will be an evaluation survey at the end of the webinar, so please complete this evaluation. It's very important for us to get your feedback so that you can continuously improve our webinars. Next slide. So on this slide, you can see the logos of the member organization of the webinar, as well as our donors that are supporting these anticipatory action and nutrition initiatives. So let me move now to our first segment, and let me introduce our speaker from the Global Nutrition Cluster team. So Angeline Grant is the Deputy Coordinator Program for the Global Nutrition Cluster Operation Team. She will start by presenting the Anticipatory Action and Nutrition Project. After that, Faith Nisoka, with the Anticipatory Action and Nutrition Advisor for South Sudan, will share key insights from her work in South Sudan. And this will be followed by a joint presentation by Dr. Abdulnasser Dawa and Salah Al-Kutami. Both are anticipatory action and nutrition support for Yemen, and they will present their lesson learned from their work in Yemen. Angeline, the floor is yours.
Super. Thank you so much, 𝗂𝗵𝗀, and hello, everyone. Thank you for joining us today. So as 𝗂𝗵𝗀 mentioned, my name is Angeline Grant, and I'm going to give you a brief overview of a specific project that the GNC has recently been involved in collaboration with the nutrition clusters in Yemen and South Sudan, which really forms the backdrop of our discussions today. This project was called Enhancing the Involvement and Leadership of Local and National Actors in Anticipatory Action, Data, Design and Implementation. So in terms of background, this was a joint submission from the SMART and GNC teams to Swedish 𝘂𝗧. So the 𝘂𝗧 2025 allocation process was specifically focused on anticipatory action. And the GNC, in collaboration with the SMART team, was really interested to expand its service offer in this particular area. And we also were able to secure co-funding from Irish Aid. So we had inception meetings with the cluster coordination teams in South Sudan and Yemen in early 2025. And we submitted a joint proposal with the SMART initiative at the end of January 2025. And Yemen and South Sudan were the focus countries, given they were both insecure contexts with obviously multiple risks and polycrises. And the cluster teams there had expressed interest in expanding their anticipatory action portfolio. And so the project ran from March 2025 to the end of this month. So in terms of structure, the first two components that you can see here on the slide aim to strengthen the nutrition information system to allow for improved early warning and trigger mechanisms for anticipatory action. So the activities included strengthening capacity on SMART methodology and nutrition real-time monitoring frameworks, the RMF, which you might be familiar with. And these two components were implemented by the SMART team. And then the third and the fourth components of this project were implemented by the GNC operations team. And so while the SMART team was focused on the more upstream data for anticipatory action, the GNC operations team was providing support for the enhanced integration of nutrition within anticipatory action frameworks and standard operating procedures and tools. And there was a particular focus on supporting local and national actors to play a greater role within these processes. So the project encompassed capacity strengthening on the topic of anticipatory action for local and national actors, as well as increasing their visibility and showcasing local and national actor experiences at the global level on this topic, which is really the primary aim of this webinar today. So this slide highlights some of the project activities and timeline, but I'm not going to go into too much detail here because my colleagues from Yemen and South Sudan are going to be expanding further on this. But just to highlight that in both countries, there was a consultative inception phase, which sought to map existing anticipatory action initiatives and activities. So that was at the start of the assignment, and then this was followed by a 3-day anticipatory action and nutrition workshop, which involved collaborative methods to develop nutrition anticipatory action recommendations and roadmaps. So the outputs of the workshops differed slightly from South Sudan and Yemen. And both of those workshops were held in the latter stages of last year. And so currently the project is wrapping up the finalization of those country-specific guidance documents. And we're now in the phase of disseminating the learning and experiences from this project. So just before I hand over to my colleagues to provide more details on the specific work in South Sudan and Yemen, I just also wanted to highlight some of the approaches that we try to incorporate in this project. So we really sought to make close connections with the upstream data activities that were led by the SMART team, and in particular the work around the real-time monitoring framework and its potential role in trigger mechanisms, which I'm sure my colleague Elijah would be very happy to provide further details on. He's also in this webinar today. And we also sought to really structure the support around the key components and pillars of an AA system. So that includes the pre-agreed and risk-informed triggers, the pre-identified activities, the pre-arranged funding, the ménee frameworks that support it, and the coordination and advocacy that goes hand in hand with all of those. As I mentioned beforehand, a key component of the support was its focus on local and national actors as per the GNC and CEDA's localization agendas. And my colleagues and our panel speakers will expand more on this dimension during the course of this webinar. Another final key component was the learning and documentation of the project experiences and the results and the processes that were adopted to go through to put in place all of the activities. And given this is a rather nascent area for the NIE sector, we thought it was very important to share as much as possible on our experiences. And so as 𝗃𝗵𝗀 mentioned previously, there's a specific anticipatory action and nutrition task force that's been set up to really provide a space for these discussions. And yeah, we'd very much encourage you to join us. We'll provide, again, the sign-up details at the end of the webinar. And with that, I'm going to hand over to my colleague Faith, who's going to give us an overview of the work in South Sudan. Over to you, Faith.
Thank you, Anjali. I can hear myself. I'm not sure why I hear the echo, but I think now it's okay. I'm Faith Nzioka, and as said, I'll be providing highlights from South Sudan experience. Next slide. I will start by providing a quick contextual elements about South Sudan. South Sudan has been ranked among the 5 most climate vulnerable countries globally. And the main hazards which overlap and compound each other include the river floods, which are recurrent during the rain season. However, consecutive heavy flood seasons in recent years have resulted in saturated land, with communities experiencing standing flood water often lasting for months. Some parts of the country experiences prolonged dry spells that have significantly affected agricultural production, pushing deeper hunger and malnutrition. We also have the impacts of violent conflict on South Sudan, resulting to disruptions in health services, increased food insecurity and displacements. And we also have the spread of diseases. And it's important here to mention that South Sudan is currently facing one of the largest cholera outbreaks since independence. The government has a designated authority to support anticipatory action within the Ministry of Humanitarian Affairs and Disaster Management. But currently, there is no coordinated anticipatory action framework in South Sudan. In 2022, anticipatory action pilot project for flooding was conducted through 𝗀𝗶𝗶𝗃 facilitated framework. And we also have several AA projects implemented by various actors. November last year, the National Technical Working Group on Anticipatory Action launched the South Sudan National AA Roadmap. And it's important here to mention that the validation workshop and the launch of the South Sudan National AA Roadmap overlapped with the development of the Anticipatory Action for nutrition recommendations. And this provided an opportunity to align the 2 documents. Next slide. As mentioned by Angeline, one of the main activities of this project was a 3-day workshop. In South Sudan, we had participation of about 80 participants, both in person and online. Day 1, we focused on understanding anticipatory action and its relevance to nutrition. On day 2, we focused on national AA initiatives, the challenges and opportunities. And on day 3, we co-designed the recommendations on anticipatory action for nutrition. Next slide. About the recommendations document for nutrition on AA. I will start by mentioning that the recommendations focuses specifically on short-term temporary measures to address immediate humanitarian needs and minimize the direct impacts of predicted hazards. So the longer term and climate adaptive strategies are not explicitly addressed in this document. This document presents the key recommendations intended to institute a structured and harmonized approach for locally led anticipatory action for better nutrition outcomes, which contributes to the national processes for AA design and implementation in South Sudan. And this is clearly indicated in the vision and the mission statements as shown in the slide. This document is structured into 2 sections. Section 1, we have the background and the rationale for strengthening AA for nutrition. And then section 2, we have the core recommendations organized around 6 pillars to guide the AA approach. Next slide. The nutrition cluster has identified 6 pillars to guide the AA approach for the sector. And these pillars were developed during the 3 days workshop. So we have the core components, which represent the essential building blocks for anticipatory action, and then the enabling pillars, which provide supportive elements for an effective AA approach. And each pillar has a key outcome, objectives, considerations or opportunities, and priority activities. Next slide. I will start with the considerations for strengthening anticipatory action, early warning systems, and the trigger mechanism for nutrition in South Sudan. And the key outcome for the early warning system triggers and thresholds pillar is a reliable multi-hazard early warning system and an effective trigger mechanism to prevent an increase in humanitarian nutrition needs in the face of predictable hazards. South Sudan currently lacks a fully harmonized multi-sectoral early warning system, so we have an existing early warning technical working group, and it has several challenges like inadequate funding, limited skilled personnel, weak data collection capacity, and nutrition cluster could consider to strengthen this multi-sectoral early warning mechanism by exploring how hazards interact, compound existing burdens of hunger and poor diets, and how these hazards create multiple risk pathways that lead to cascading threats to nutrition. During the 3-day workshop, participants identified drought, floods, disease outbreaks, and conflicts as the many predictable hazards likely to negatively impact the nutrition situation in South Sudan. We also have existing weather-based thresholds and trigger mechanisms for drought, and this is led by the South Sudan Meteorological Services, which is supported by 𝗃𝗵𝗄𝗃 Climate Prediction and Application Center. We also have several nutrition-specific vulnerability platforms which are currently being explored in South Sudan, and this includes the NUVAC, the Nutrition Vulnerability Assessment Crisis. We have the Nutrition Real-Time Monitoring Framework, and we have the Meriam initiative. And these tools offer specific opportunities in relation to anticipatory action for nutrition. But as I said, these opportunities are still under exploration and require further testing and piloting. Next slide. This is an example of a timeline of nutrition crisis in South Sudan, which is highlighting seasonal patterns of drought and floods and their potential impact on key determinants of malnutrition. And here we overlay information on the potential impacts of drought and floods on nutrition situation with the seasonal calendar. And this allows stakeholders to determine windows of opportunity for anticipatory action. And this will help different types of actions to be triggered at different stages. And we'll see another sample on this shortly in the next slides. Next slide. We have considerations for developing nutrition anticipatory actions in South Sudan. And when I say anticipatory actions here, I mean the interventions, just to make sure we take note of the difference between anticipatory action and anticipatory actions. So the key outcome for the pre-agreed nutrition anticipatory actions is relevant anticipatory actions are implemented in a timely manner and at scale to prevent an increase in acute malnutrition among at-risk and fragile population groups prior to a predicted shock. Important to note is that the humanitarian needs response plan in South Sudan currently covers only joint and intersectoral analysis framework, the GIAF, priorities 1 and 2, and this leaves many 𝗵𝗄𝗃 Yemen counties in phase 4 they're excluded. So there's increased vulnerability, especially in 𝗵𝗄𝗃 Yemen phase 3 or 4 counties, with low operational capacity and limited partner presence. And therefore, we proposed tailored AA packages and delivery modalities to be developed from different geographic areas based on program coverage, operational capacity, and the presence of partners. We also have existing challenges with nutrient supplies, shortages, and access issues. And these constraints underscore the need for robust preparedness and readiness plans to enable effective implementation of anticipatory actions. We also advocate on building on existing capacities based on the current nutrition cluster project activities, which can be scaled up and or complemented by other anticipatory actions in the face of disasters. And also, nutrition cluster could engage with other stakeholders to advocate for the inclusion of nutrition-sensitive anticipatory actions within ongoing projects. Next slide. This is an example of a phased approach, and this is for slow onset hazards. such as drought. This approach identifies multiple windows of opportunity for action across the duration of the slow onset event by setting different triggers and anticipatory actions for different levels of risk at different points in time. So the initial trigger will activate a first set of readiness measures and anticipatory actions. For example, dissemination of early warning messages for nutrition and increasing monitoring of nutrition indicators through mark screening. Then the next level trigger, which is a complementary alert issued by the weather forecast and the results of the mark screening, will now activate more targeted and specific actions for acute malnutrition prevention and management as the potential severity of the impact becomes confirmed. Next slide. Here we have the opportunities to enhance financial access for coordinated air in South Sudan. And the key outcome for finance mechanism for air for nutrition is to increase availability of diverse and sustainable funding streams for anticipatory action for nutrition. And in South Sudan, both build and fuel finance is needed, especially now with the newly launched South Sudan Anticipatory Action Roadmap. The build funding is necessary to support the enabling and establishment of inclusive anticipatory action systems and active frameworks. And of course, the fuel finance for operational activation of pre-agreed actions. We have existing pool fund mechanism in South Sudan, which nutrient cluster can engage to finance AI approaches for nutrition. And we have some examples provided there, as well as other donors, funding mechanisms that have supported AI activities in South Sudan, as also indicated in the slide. Next slide.
Faith, we're almost out of time. If you can just wrap up your last few slides. Thank you.
Okay, thank you. We have opportunities for enhancing the role of LNS in air for nutrition South Sudan. We have the local response full fund, which supports the increase in localization, and we'll be hearing more about this during the panel discussion. We also have the South Sudan Nutrient Cluster Localization Workshop, which the nutrient cluster could leverage while they are developing the comprehensive localization matrix or roadmap for nutrient LNS in South Sudan. We also have established community-based systems which we can build on because they are well positioned to access hard-to-reach areas, and they're also able to move with the displaced populations. Next slide. We also have opportunities for evidence generation and learning for AA for nutrition in South Sudan. And here we are saying we could adapt the existing monitoring and evaluation framework and nutrition information systems. For example, adding new indicators. We should also consider all components of AA, and we have a good reference document from World Food Programme. We could also explore a MERIAM initiative by comparing the actual nutrition situation after implementing anticipated actions with MERIAM generated predictions, and also engaging with existing learning platforms for anticipatory action, like the GNCA and the Nutrition Task Force. Next slide. We have also opportunities for sustainable coordination structure. As I mentioned earlier, there's a good level of institutionalization of anticipated action into government systems in South Sudan. And this diagram illustrates a proposed coordination structure for the nutrient cluster, which shows how roles and linkages can be organized across different technical working groups, task forces, and national platforms. Next slide. And here we have a summary of key activities or outputs which are expected to be achieved in 2026. I may not go through everything, but as we see for the first pillar, we need to have a validated multi-hazard models and triggering mechanisms by June 2026, pre-agreed anticipatory actions catalog developed, AA for nutrition financial protocols established. We need to have AA for nutrition localization strategies developed, monitoring and evaluation framework and after action reviews and impact evaluations approaches developed by December 2026, and then the functional AA for nutrition coordination structures established by February 2026. I think that is my last slide. Thank you, and over to Yemen colleagues. Thank you.
Thank you, Faith. Good afternoon, everyone. About Yemen anticipatory action lessons learned, we start firstly with an overview of about the whole, project. Maybe we can move to the next slide. We will not try not to, repeat what has been already mentioned, but we will focus more on the methodology which we have worked on during the inception. It consists of this review as well as PIIs. PII questionnaire has been designed in Arabic and English, and about 25 local national actors were consulted during this inception phase, and then followed by a 3-day workshop where around 58% of the participants were from local national actors. And all these inputs were gathered to formulate the roadmap for Yemen. We can move to the next slide, please. So what went well? The participation in the whole process was with high rate, as local national actors particularly were very interested and engaging at this initiative. We are talking about government, UN, also international and local actors. As we mentioned, around 80 participants attended the workshop in Aden, which is very good. The engagement and the interest also from the local national actors is reflecting that permissive and supportive environment for activation of the anticipatory action here in Yemen. The good thing also was that the roadmap was already developed as a draft, and it is being validated and will be finalized soon with inputs from technical line ministries, from local and national actors as well. And one of the good things that also is the Arabic translation and considering also the localization for national local actors. And at the end, a lot of products were developed, including inception report, workshop report, and the final roadmap drafts that will be developed as well soon. Next slide, please. Yeah, one of the also things to consider was the recommendations from the workshop that a lot of partners and local actors requested for more capacity strengthening activities, and also this indicates that there is high interest in anticipatory action, and local actors are trying also are interested to know more about more technical details about the anticipatory action, particularly for nutrition. Also, this initiative was led at the national level. We have also a lot of requests from the subnational and governorate level to replicate and also maybe extend more capacity strengthening activities at the governorate level. Next slide, please. The key actors that we work with, mainly from the technical line ministries, starting with the Ministry of Public Health and Population, MOBIG, Ministry of Planning, International Cooperation, and also Ministry of Water, as well as the SUN from MOBIG as well. We work also with clusters, local NGOs, international NGOs, OCHA, and also other stakeholders. And the stakeholder analysis was also initially implemented during the inception phase. Next slide, please. From now, I will let Dr. 𝗵𝗲𝗁 continue. Thank you.
Thank you, Salah. Welcome, everyone. We will start with lessons learned. Nutrition interpret in anticipatory action we have identified during the inception and the workshop, and we are using them in the roadmap. First is using the early warning signals that is available in Yemen. We have, for example, EDUs, we have also nutrition information system, but these need to be integrated, and we are developing triggers to be used in the roadmap. Now we are developing triggers for each hazard. Also, we are preparing pre-agreed nutrition anticipatory action package for each hazard, and it is now in the roadmap. We are working in the validation, and we have ensured that all nutrition actors are involved and consulted and in the core of these actions. Also, we are ensuring financing for nutrition anticipatory action. We have met a lot of advocacy meeting with 𝗂𝗂𝗶𝗀, and however, in Yemen, not like in South Sudan, there is no already dedicated fund for anticipatory action, but 𝗂𝗂𝗶 will work on that to dedicate some of YHF funding for anticipatory action. Also, advocacy, we are continuing and working with the already existed anticipatory action system headed by 𝗂𝗂𝗶 and the Ministry of Water. Next. Regarding the governance and activation, we are working on the existing system. We don't want to make a parallel system. Also, we have composite triggers needed for effective action that will guard the activation. And also, we have developed and used the already available seasonal calendar, which have been developed by the Ministry of Public Health. Next. Regarding the localization and local national capacity, we have ensured that local national actors in the center of this project, and they have supported us in the planning and in the implementation. And now in the roadmap, we have a lot of local national actors that have a lot of experience in anticipatory action. Also, we are working and recommended that institutional strengthening is essential for the local national actors. Community intelligence remain underused as anticipatory inputs. In Yemen, we have a very golden opportunity. We have a lot of community health volunteers, community health nutrition volunteers, and community health workers that can support us in identifying the early warning, for hazards. Next. Financing and readiness. This is the main neck issue challenge in Yemen. Financing is now my main challenge, and we are working on crisis defiance, and we will explore micro grants. We have identified some. In future, a local national actor will use them. Next. Regarding the data decision activation chain in Yemen, the already weak system is fragmented and reduce anticipatory action decision making. We are developing the real-time monitoring framework. If you have attended yesterday the workshop, it will be used to identify and guide this response and ensure it is timely available. And decision use matters more than data availability because financing and governance is also a main challenge. But when real monitoring framework will be activated, it will be main activation of these inputs. Also, we are developing tools fit the local national actors and sub-national users, and their capacity building is an eminent component of this project. Learning documentation is essential, and it will be shared with all NGOs. Next. Opportunities in Yemen. We have high localization potential. We saw this in the inception. We have a lot of experts here, and they supported us in the planning and also in the roadmap developing. Also, we will develop a nutrition and security action package concept, which is somehow there is a lot of project using them, and also governance and triggers financing must operate as one coherent system. We are ensuring that. Bull fund, exploring crisis modifier. This is one of the opportunities also. And subnational coordination platform. This is an essential component, and we hope that a fund will be available for it. And high learning value for global guidance. All documents regarding the inception, workshop, and also the roadmap is collecting input from all entities, and this will ensure they are involved and they will be implementing it. Next. Practical recommendation. We will develop them an adaptation nutrition technical guideline in Arabic, establish composite triggers guidance. This will be in the roadmap. Also investing in long-term local national actor in institutional capacity, and strengthen financing pathway and cascading capacity strengthening is the subnational. Thank you. This is the last slide. Yes. Next. Thank you, everyone.
A big thanks to our first presenter and for those very insightful presentations that give us an overview of the work that has been done in both countries, South Sudan and Yemen. As we build on this reflection, so we will now turn to our panel discussion, and I'm very happy to welcome our panelists joining us both from South Sudan and Yemen. They have been closely involved in anticipatory action and nutrition work. So with this perspective, we will unpack several critical dimensions of anticipatory action systems, including financing mechanism, coordination, government leadership, early warning system and trigger, and finally, the essential role of local and national actors. So you can see on the screen our 5 panelists, and I will start by welcoming 𝗃𝗶𝗀𝗃𝗃. So 𝗃𝗶𝗃 is a financial economist and humanitarian leader with over 15 years of experience in localization, public finance, and development programming in South Sudan. He serves as a chairperson of the local response pool fund and is the founder and executive director of Global Aim South Sudan, advancing locally led, accountable, and sustainable humanitarian financing. So 𝗃𝗶𝗃𝗃, I have a question for you. Advocating for flexible and pre-agreed financing is essential for enabling locally led anticipatory action. So in South Sudan, the local response pool fund was created to strengthen localization by giving local and national NGOs greater access to donor funding and a stronger role in decision making. So 𝗃𝗶𝗃, could you share how this fund has supported local actors in implementing anticipatory action, and what opportunities exist for the nutrition cluster to engage with this fund to secure dedicated resources for community-led anticipatory action for nutrition? You will have 3-4 minutes to answer. Over to you.
All right,
𝗃𝗃𝗃𝗃.
thank you so much. Good afternoon, everyone. Sorry, I have trouble with my camera. We request that I present without the camera. Thank you so much for that brilliant question. First of all, from an Arabic perspective, locally led anticipatory action is enabled first and foremost by how financing is structured, governed, and trusted. The fund was established in 2021 by national and local NGOs to operationalize localization commitment under the grant bargaining conference that happened in Istanbul in 2016, while partners such as Save the Children and other international partners supported our systems in compliance and donor engagement. Up-to-date local actors retain leadership over funding, priorities, and allocation of decisions. This shift from implementers to decision makers is foundational for anticipatory action, of course, definitely. Second, the 𝗃𝗶𝗃𝗵 South Sudan provides direct and flexible funding to local organizations. And to date, it has mobilized around 2.5 million United States dollars, supporting more than 25 national organizations. And just to bring you to speed to mention, today the Local Response Pool Fund South Sudan have up to 205 members duly registered and that subscribe to it. That would otherwise struggle to access donor funding. By moving subcontracting layers, local actors are able to act as early as possible when the warning signs emerge, rather than waiting for full emergency declaration. So this 2.5 million has gone directly to the national actors. And we believe that this flexible funding has translated into practical anticipatory action on the ground. For example, we up-to-date hold 3 flagship examples, which included pre-crisis cash assistance, enabling households to prepare ahead of floods and lean season. You know very well South Sudan is susceptible to flooding due to the climate change. Community-led flood preparedness, this we implemented this in 2022 and early 2023, which included construction and reinforcement of protective decks in high-risk areas, particularly in Maban. One example also included the local disaster preparedness committees, strengthening early warning interpretation, coordination, and response at the community level. Importantly, the fund also invests in governance, accountability, and reporting systems, ensuring anticipatory action strengthens long-term local capacity, not just short-term project delivery. Today, the Local Response Pool Fund has a fully pledged independent office with all the structures. The secretariat is led by a very qualified secretariat team, and the board of trustees, which I share, is led by a 9-member organizations. Turning to opportunities for the nutritional cluster, I believe there are clear and practical entry points. First, the Local Response Pool Fund can host a dedicated anticipatory nutritional funding window with ring-fenced resource for local and national NGOs to implement early interventions, such as maternal and child nutrition support, early screening, and protection of household food consumption before malnutrition escalates. And second, I believe that the nutritional cluster and the 𝗃𝗃𝗃𝗵 South Sudan can jointly agree on nutritional specific early warning triggers, including the GAP, that's the global acute malnutrition, market price movement, or seasonal climate forecast, linked to pre-agreed and rapid fund release. Thirdly, I also do believe that this partnership enables a rebalancing of roles. Local organizations can lead implementation and community engagement, while the nutritional cluster focuses on coordination, technical guidance, and quality assurance, strengthening effectiveness while advancing localization commitment. And this, I believe, if we work together in partnership with the global nutritional cluster, we can forge a better way forward. As I conclude, I hope I'm within the time, I want to say this. If anticipatory action for nutrition is to be truly locally led, financing must be early, flexible, and trusted. The Local Response Pool Fund offers a tested platform to move resources closer to communities before nutrition outcomes deteriorate, not after. And this has been exemplified in our past projects to date. I thank you.
Thanks so much, Ronbek, for these insights and for advocating for a strong role of local and national actors in providing opportunities for them to play a central role in anticipatory action for nutrition. Let me now turn to 𝗃𝗵𝗃𝗀𝗁. Welcome, Rich. So Rich is the acting South Sudan Nutrition Cluster Coordinator and the roving Nutrition Cluster Coordinator for the Greater Upper Nile region. He coordinates nutrition activities across South Sudan to strengthen preparedness, response, and collaboration in crisis-affected communities. So Rich, we know that effective coordination is key to leveraging each sector's comparative advantages for anticipatory action. However, yet nutrition is still not fully integrated into anticipatory action efforts, with nutrition clusters often insufficiently involved in anticipatory action initiatives and limited inclusion of nutrition in anticipatory action protocols and tools. So could you share how the nutrition cluster in South Sudan has been engaged in ongoing anticipatory action initiative? And looking ahead, what are those opportunities for the cluster to engage further with national planning processes and stakeholders active in anticipatory action? Again, you have 3-4 minutes. Over to you.
Thank you so much, Domi, and good afternoon, colleagues. I would like to thank and recognize the presence of our government counterpart, nutrition partners, and then the UN family, and then also the GNC. What I would like to say first is that this initiative of the anticipatory action is an eye-opener. Before phase came in, we were working in silos. So when phase came in, we were able to, when we tried to reach out to the government and partners, we discovered that the government and partners were already on the anticipatory action roadmap for South Sudan. So it became an opportunity for us to get involved with them. We were able to attend some sessions with them. And also we were able to meet IGAD, which was also on the same mission. So that was really very great opportunity. Now coming back to South Sudan, how nutrition cluster can be or have been involved in anticipatory initiative in South Sudan. We have so many ways that we have been doing this. And one important area is the 𝗊𝗶𝗄, which has been considering the deterioration in some of the areas using some possible indicators. So we have been able to map out the hotspot areas, especially areas under the phase 4 and 5. Those areas we have been able to monitor them. Other thing that we have been able to use in South Sudan, we have food security and nutrition monitoring system survey that is done annually. So it has been a tool that we have been able to use as anticipatory action because the indicators have been used to monitor the situation across the country. In addition to that, we also do assessment like the smart surveys. So those smart surveys are being used to help us to see what is going to happen with the experience in the country that we have already. Then we have also been using the routine data. In South Sudan, we have the nutrition information system data that has always been used for by the nutrition partners. So that data, we are able to analyze it, and then we anticipate what is going to come based on the result. In addition to that, we also activity info that is based on 5 Ws. There is another data that we have been using. And coordination with the partners, both in Juba and also at the subnational level. Our nutrition cluster in South Sudan is reaching up to the county level, where we are represented at the county level by the county health department, especially the nutrition focal person. So we are able to anticipate, we are able to monitor everything through that hierarchy. Now, coming to opportunities for the future. Now, after the training or workshop that was done by GNC through FACE, we were able to come with a recommendation. And one important recommendation is the formation of a technical working group that will involve localization, anticipatory action, and then the RMF. That has not been existing, but we are going to form that. And it was mentioned before by FACE. And then we shall be reaching out to work with the National Ministry of Humanitarian Affairs and Disaster Management, and also the Ministry of Health. Ministry of Health has been our implementing partner of the government, but we have not been involved in this roadmap. So those are the people that we're going to work with, and it is because of that that workshop. Then another area that we also going to include is especially the multi-sectoral approach, whereby we involve health, which FSL, protection, and many other sectors to be able to work together to design an AA that will be able to serve all of us. One area, especially for nutrition, we have like the positioning of the nutrition supplies ahead of the rain, because when the rain comes in South Sudan, roads are normally blocked during the wet season. So that is another thing that we will be able to use as an opportunity. And then mass work screening that we are trying to develop. We have been trying to use it, though it has faced lots of challenges, but it is a tool that we will have to improve on so that we can be able to use it in that way. And then behavior change communication, which has been part of the nutrition. Then another thing that also that have been coming up, we have the NUBAC, the Miriam, and then RRF, of course. So those are another area that we have to be able to develop and then implement in South Sudan, because they have been initiated, but it has been slow to take impact. So with those, we can be able to achieve an AA that can be able to support our work with the partners. Another thing that we will also have to leverage on, and it was mentioned by the speakers ahead of me, is the funding. Funding has been the challenge for our partners and also the government. As you know, South Sudan is a young country that has all problems that you can be able to come across in the world. So funding is very important. So it will be part of our important advocacy within the policy. So up to there, I would like to stop and over to you. Thank you. Domi.
Thanks so much, Rich, and for all these very important elements. And let me now move to our panelists from Yemen. And let me first welcome Karima Al-Hada. So Karima is a planning and liaison specialist in the Sun Secretariat at the Ministry of Planning and International Cooperation in Yemen. She led the development of Yemen's multi-sectoral nutrition action plan, the communication and advocacy strategy, and the establishment of the Sun networks. She also serves as assistant convener for food system, leading the national food system dialogues and the development of Yemen's food system pathways. She currently supports national efforts to strengthen the humanitarian development peace nexus for more effective nutrition intervention and work to reinforce national nutrition platform by convening government, UN donors, private sector, and civil society stakeholders. So Mrs. Al-Hada serves on the Sun Executive Committee, the Sun Finance Task Force, and the Nutrition for Growth 2025 working groups, and is engaged in several global food and nutrition platforms. Karima, you have played a central role in strengthening multi-sectoral coordination for nutrition in Yemen. From your perspective, what are the most critical steps needed to better integrate anticipatory action for nutrition into national nutrition systems and policies? And how can platforms like the Sun Network help ensure government leadership and cross-sectoral collaboration for anticipatory action in fragile contexts like Yemen? You have 4 minutes. Thank you. Over to you.
Thank you so much. Can you please confirm that you're hearing me very well?
Yes, loud and clear.
Thank you so much for the question, which actually nicely complete the interventions of my colleague panelists. From Yemen's perspective, anticipatory action for nutrition is not just abstract concept. It is a daily necessity, since nutrition deterioration is driven by predictable and recurrent shocks, as you know. So these risks are well known, yet our responses often come fragmented, thinly distributed, and too late after malnutrition has already escalated, unfortunately. In response to your specific question on leveraging the contribution of multi-sector coordination for nutrition, and Yemen is just an example, I would emphasize that the integration of anticipatory action into national nutrition systems requires 3 interconnected steps from my perspective: governance, convergence, and capacity. For the governance, anticipatory action must be anchored within the national frameworks so that it's not seen as external project, but as a government-led mechanism. In Sun Yemen Secretariat, we have worked on strengthening nutrition governance structure at national subnational level. We activated the national governance structure, established also one of the accelerated programs governance structure at subnational level as an example. These platforms ensure the accountability, coordination, government leadership, which are critical foundations for the anticipatory action. Looking ahead, the governance structure will embed and integrate the anticipatory mechanisms directly into local planning, assessment, and recovery strategies at the governorate level. For the second point on the convergence, and this also is built on the area-based approach, is to embed anticipatory actions into multi-sector platforms to ensure that they are, contributing to the prevention of nutrition and not fragmented, but delivered in a coordinated way. The anticipatory action is mostly effective when the multiple sectors converge on the same vulnerable community, and this is very important from our perspective. We have prioritized the collaboration of all necessary levels, from the high level in the National Steering Committee to the technical teams to the sector working groups across health, education, social protection, agriculture, fisheries, water, and similar stakeholders also at the same at the subnational level. This convergence reduces the duplication and maximizing the resilience. And in this way, you can see easily the linkages between this and the anticipatory actions to protect livelihood and the gains in preparation or, for during the shocks. The last point on capacity, the anticipatory action requires technical skills, but also trust and collaboration across the institutions. Regular multi-sector working group meetings and peer exchange strengthen the ability of ministries and partners to act collectively and confidently when, or during the early warning signals appear. In this regard, we have positioned the SUN platforms, including the SUN networks, not only for coordination, but also for learning and trust building. These efforts strengthen the humanitarian development nexus, equipping stakeholders with skills and tools, and act early and collectively. However, more knowledge and products and tools on the AA are needed to further build institutional capacities and ensure evidence-based decision-making. In fragile contexts like Yemen, anticipatory actions in nutrition is not just about acting early, it is actually about acting together under the government leadership to ensure the sustainability with a strong governance, convergence, and capacities. And this is how we can prevent malnutrition before it escalates into crisis. Thank you so much.
Thanks so much, Karima, for those important points and highlighting the role of the government and of the SUN network to support this new area of anticipatory action for nutrition. Now, let me introduce our next panelist, Patrick Ochaya. So Patrick brings extensive expertise in disaster risk management and anticipatory action, effectively integrating these approaches into organizational programs to combat food insecurity and build resilient livelihoods. He has been instrumental in advancing anticipatory action across East Africa, with notable contribution in South Sudan, where he supported the development of robust disaster risk management and anticipatory action framework. He is currently working with the World Food Programme in Yemen to further strengthen anticipatory action and early warning systems as early warning and anticipatory action advisor for WFP. Patrick, you work closely with forecasting system and triggers for anticipatory action. From your perspective, what are the most effective ways to reflect nutrition within early warning system and trigger mechanism? And what conditions are needed to ensure that nutrition indicators can inform anticipatory action in a context like Yemen? Again, please, you have 4 minutes, and please try to stick to those 4 minutes so that we have enough time for Q&A at the end. Thank you. And I'm also inviting all our participants, if you want to ask questions to our panelists or presenter, please put your question in the Q&A box. Patrick, over to you.
Thank you, Domi. Greetings to everyone, wherever you are. Thank you for that insightful question. And I normally like to link it, based on, of course, the few engagements, especially in some of the workshops here related to this project. I like to link this question more to why nutrition has delayed to kind of surface in this whole AA development process. And some of the thoughts I was having, is it because always nutrition outcomes are treated as lag indicators, or what exactly is the reason? And I think having engaged and been part of this project or activity, some of the findings from the project indicate that, largely the actors, especially nutrition actors, are largely isolated from most of the national AA development process. The systems are largely reactive, and we can agree with that. The data collection is normally late, or more in a reactive format, and not looking at, what's ahead. We have challenges of, because of the absence maybe of the nutrition actors at the early stages of the development process, we miss out on nutrition indicators that would otherwise be very useful for us when we are developing these triggers and all these other models that help us to predict, the situation ahead, whether it's food security or nutrition. And so I think for the integration to be there, we need to understand why, first of all, that in the first place they are not there. And so to do that, I think going forward, we need to effectively integrate the nutrition into this. We need to, right from the start, when we are doing the risk assessments, when we are doing the identification, the targeting, and so on, we want to encourage the nutrition practitioners to be present at that stage already. And I think the linkage or the understanding that, currently we understand that most of the triggers and the trigger mechanisms are so focused on the key drivers of some of the vulnerabilities. So we look at the main hazards like the floods and the droughts and so on. And we normally factor nutrition at the tail end, as, okay, what happens after flooding has happened? One, the damage to property, livelihoods, and so on. And then after that, now we start to look at, how has this manifested in terms of the nutrition status? And so it comes late. So we need to right away as nutrition practitioners, right from the start, we need to look at the historical past and look at how these hazards have historically interacted with the different factors within a specific locality to drive either to worsen food insecurity and nutrition, or the other way around, or to improve. And this will become the basis for us in determining what key indicators to factor in our modeling and also our scenario building. And so key points there. One, the scenario building, where we look at past, based on past events and looking at current conditions and linking it to these hazards or the key drivers of food insecurity and malnutrition, and how these ones have interacted in the past. How have they, translated into GAM rates and MOAC and so on? And how do we link these, whether standalone or interconnected to these hazards? These are things that we need to effectively be discussions that all nutrition, personnel have to be involved in right from the start. From my observation, I think, largely from the nutrition sector, there's been a bit of hesitance from the technical people, whether for whatever reasons, we are yet to find out more. But I think it's time to come on the table and begin to push the agenda of ensuring that nutrition is fully present in all these discussions and processes of developing anticipatory action. What conditions are needed? I'll run through fast. One, of course, we need to improve our data collection mechanisms. One, we need to make them more frequent. The windows within which to collect this data, do they reflect, the previous events that led to the nutrition deterioration or improvement in the past, and how do we link them to ensure that we avert similar outcomes in the coming future? Two, do we have we need to push for strategic resource allocation with the finances that are coming to the basic nutrition program. Can we allocate some to facilitate the design of these trigger mechanisms? Because without that, as you've heard for Yemen's case, where there is no allocated funding for AA, that means we need to find ways within our organizational structures to allocate some funding to support the development of this science and the tools. Three, the government, of course, buy-in. And I see this is a key problem, that most organizations sometimes operate without the full involvement of the government in this process. And at the end of it, when you develop things and they are not in alignment with the national strategies or frameworks, they can often at times be considered as irrelevant. And so considering the government at the earliest point and working so closely with them will be very, very important. I mean, and of course, standardization of, the methodologies that we are talking about. We know that there are different partners here and there, all speaking the language of nutrition. And so that means that in terms of data collection processes and in analysis, there are all these variations. So we encourage create this condition. We need to all come together and create standard protocols and frameworks that can be used across to support the development of these triggers such that they are all accepted and usable by many. And of course, there are elements to do with capacity building and and all these other parts that, because of time, I cannot go into. So thank you, Domi. I think I'll stop there irrespective of the additional points I have. Thank you.
Thanks so much, Patrick. And I think you had a great point and a great call for a nutrition actor to be part of the work around risk assessment and the developmental triggers, to be more present. So well received this call. Let me now move to our final panelist, Dr. Omar Alameri. So Omar is a National Health Officer for the Yemen Red Crescent Society and the Regional Coordinator, Community Health, Community of Practice, IFRC Middle East and North Africa. Dr. Omar is a medical doctor with a master's degree in community medicines and over a decade of experience in public health, emergency response, and humanitarian health programs. He had senior coordination and health leadership roles with the Yemeni Red Crescent Society and IFRC, specializing in epidemic preparedness, community health, and health programs in emergency settings. Omar, through your work with the Yemen Red Crescent Society, you have extensive experience supporting community-driven approaches. From your perspective, how can local and national actors co-design and co-drive anticipatory action? And what lessons from the Yemen Red Crescent Society's experience can help strengthen locally led anticipatory action for nutrition? Again, you have 4 minutes for this question. For participants, Omar will speak in Arabic, so please select English or French if it's your preferred language using the interpretation function. It should be at the bottom of your screen. There is a globe as an icon, and you can select the language you prefer. Omar, over to you.
Okay, good evening, everyone. I will speak in English. It's okay.
Omar, I mean, feel free to speak in Arabic or in English, really, as you prefer.
Okay, it's okay. Okay, from my perspective and my experience with Yemen Red Crescent Society, anticipatory action for nutrition works best when it's co-designed and co-driven, not simply consulted only. This means genuinely sharing leadership and decision-making with local and national actors from the beginning. One of the strongest lessons from YRCS is the value of community intelligence. Our volunteers live in the communities that they serve and often identify early warning signs such as rising food prices, reduced meals frequency, disease outbreak, or infants feeding challenge. This will appear before this will then before it appear, and also we have almost around 25 health centers all over our country, and we have in the health facilities a department which is nutrition department, which specialized working with the MUAC and screening the nutrition for children and for the pregnant women and also the motherhood. And also we have a lot of activities in YRCS, such as outreach. We are spread a lot of teams in the rural areas to screening the nutrition, the MAM and SAM and to make a referral for all of them and to maybe to deal with those things in this rural area. And also co-driving also requires clear roles with flexibility. Communities help identify risk and guide what support is appropriate. �활𝗂𝗃 branches, as I mentioned, 25 branches maybe over the country, can coordinate the volunteers. We have a huge of volunteers in our country belong to �활𝗂𝗃, and all of this can carry rapid assessment and deliver early nutrition actions. National authorities play a key role in endorsing triggers and linking anticipatory actions to national plans, while partners and donors enable this through flexible financing and technical support. Maybe our this decentralized structure has consistency allowed earlier action, especially in fragile and hard to reach area. Another key lesson is shifting nutrition anticipatory action from rapid response mindset to prevention, which is easier and can affect. Nutrition support comes after malnutrition rates rise. �활𝗂𝗃 experience shows that impact of acting earlier through timely cash when food prices increase, prevent infants and young children feeding, consulting before lean seasons, early wash actions, all those things that we are doing in the land or in actual. And very positioning nutrition supplies, preventing negative coping strategies is far more effective than treating severe malnutrition later. Do you know why I mentioned in the first, the prevention is better than to treat or something. Okay, finally, financing matter is our obstacles, which is located lead and anticipatory actions fails when funding is slow or centralized or now, as you know, funding to Yemen or transfer the fund to Yemen is so difficult. But those things can make obstacles to our anticipatory actions for the nutrition. And we can very agreed financing linked to triggers, rapid access at branches level, and flexibility are essential. In nutrition, speed often matters more than perfect precision. In conclusion, our society, which is Yemen Red Crescent Society, experience shows that locally led anticipatory actions for nutrition is not only possible in Yemen, but it is very, very essential. Thanks for all of you.
Thanks so much, Dr. Omar, and also, I mean, it's great to know that Yemen Red Crescent Society can bring this great experience and can has shown that yes, locally led anticipatory action is not only necessary but is also possible. I will now move into the question and answer session. Again, a huge thank you to all our panelists. I think it was really useful to listen to you to understand a bit further what are the challenges, but also the opportunities ahead for advancing anticipatory action for nutrition. So we are running a bit late with the agenda, but we can take maybe a few minutes, really 1-2 minutes for the question and answer. I'm not sure that we have question in the Q&A box for now. So if you want to ask a question directly to our speaker or panelist, please, you can raise your hand and we would you would be we will sorry, and we will give you the opportunity to ask the question directly to the panelist. Anyone wants to add a question to one of our panelists or speaker? Okay, I can't see any question both in the Q&A box. Yes?
فتح is raising his hand.
Okay, there is someone asking for a question. Sorry, I can't. So we will, with raising hand. Sorry. Okay. So Miriam, can we allow? Is there someone who wants us to? Just please raise your hand, and we will give you the opportunity to ask directly the question to the panelist.
Yes, he فتح العامري is raising his hand. Look in the attendance.
Okay, so I'm not sure. I can't see the. Okay, now I'm saying so. We have two different raised hand. So let me. Okay, Fateh Alamari, I think you can. Your mic is. You're on mute, so please ask your question.
Hello, do you hear me?
Yes, please.
Yeah, thank you very much. This is Fateh Al-Amiri, Fateh, from 𝘃𝗶𝗀𝗃, Yemen, 𝘃𝗵𝗶𝘀. 𝘃𝗶𝗀 was really aware of this exercise that was conducted and facilitated by our colleagues Salah and Dr. Abdel Nasser. They played a very great effort, and we are anticipating a very good results out of this approach. This is very good project for us. We are starting in our areas with so many crises, particularly the climate issues. Yes, the Dr. Abdel Nasser was saying that YHF was showing their willingness to allocate some of the funding for the anticipatory action. For them, we are seeing many funds in rural countries. I think
Sorry, I think we are losing you.
Yeah, sorry, it's an internet issue. But
yes.
For now, yeah. So we are having more funds that comes from Gulf countries, particularly KSR and other donors. I think we need to pay attention to that and to advocate more with these donors so that they can adopt this approach. It is very important for us to advocate with these donors. From 𝘃𝗵𝗃𝗃 in Yemen, we are ready to have a pilot exercise that is as an extension for this national framework, and we can validate any pilot project that could make this very successful, and we will operate to this project very successful. I'm not sure how doctors, how do you think of this initiative? And also my question is that why do we have efforts to advocate with Gulf donors to adopt anticipatory action? Thank you so much.
Thank you for your comments and question. I'm not sure we got all your point, but I think the last question was clear. You were asking whether the Gulf donors could be approached to support anticipatory action.
Yeah, and my second question was, we are in 𝘃𝗴𝗃𝗃𝗃, the hub with a very severe crisis in terms of drought, watering issues, and climate issues, as we are covering, and we are including coastal areas. So if we have something pilot in our areas, it will be very successful, complementing the national approach that is already discussed and supported. Thank you.
Thank you. I mean, just we're going a bit over time, so we will take another 10 minutes and finish in 10 minutes the webinar. I hope participants, you can stay with us, and I will turn to Karima. I guess Karima, you want to answer to Fateh's questions?
Yes, thank you so much. Actually, there were very important questions. So I will start with resource mobilization or fund mobilization from the Gulf countries and other, expected funds going into Yemen, inshallah, in upcoming months and maybe weeks. So yes, we are working on this, and we are holding several preparation meetings and donor briefing with these partners. So this is well noted. On 𝘃𝗴𝗃𝗃𝗃, we are currently working with GNC, with Amin Rakwan. I don't know if you have met him there. It was on the subnational assessment and planning tool with GNC and the colleagues here. And we have discussed actually the anticipatory actions, which are integrated within the action plan in 4 districts. So we will communicate with you after this, and we will see how we can improve this AA action integration within the subnational planning of these 4 districts. If you allow me for the other question in the chat, it was about the trust building, and maybe I can contribute also to it. The trust building, it's not because we don't trust each other, it is because we don't know each other, and we're not working collaboratively at the right level, as my colleagues indicated. So, the stakeholders, they come with their perspectives, their technical experience. So having them together in one place will allow them to exchange knowledge and also to understand the position or the standpoints of other sectors, and will work collaboratively in that respect. We have been, doing this for a long time, and we see the results in more collaborative and collective way. And sometimes at the beginning, you can see that the lack of trust is just a lack of understanding and knowing each other. But with the several meetings and exchanging knowledge, they start to understand the positions of others and also work collaboratively. Thank you so much.
Thank you, Karima, and for also this great point. Trust, start with knowing better each other. I'm afraid we don't have really time to take another question. I see there is Razan, you have raised your hand. I just would like to invite you maybe to put your question in the Q&A box so that we can answer to it afterwards. Next slide. So let me just wrap up this webinar. First, again, really a huge thank you to all our speakers and panelists. It was incredibly insightful listen to you and the work you have been doing. I just want next slide. Just to say that I really hope we will continue this dialogue and this reflection on how to advance the anticipatory action and nutrition agenda. And for that, I just want to remind you that there are other opportunities to come to exchange on this topic. Next slide. One of them will be this session will be both online and in person at the Humanitarian Network Partnership Week, so the 10th of March. And the topic will be about predicting and preventing, mitigate malnutrition in the face of predictable crises. I will also just to remind you and encourage you to share your experience to our country example. And for that, you can reach out to us and contribute to the collective learning around anticipatory action and nutrition. So feel free to go on our webpage, the webpage of the Anticipatory Action and Nutrition Task Force, and you will get our contact. So happy to get in touch and see how you can also share your learning. Next slide. And here is just a quick reminder that on how to access nutrition in emergency support. So the GNC is providing support on request, and so there is opportunities to want to have requests according to your need. It could be a remote or in-country technical support. We can hire a consultant directly, or we can also provide a quick technical advice, and we can also provide some peer support. So don't hesitate to go on our webpage, nutritioncluster.net, and click on request support. It will take you only 5 minutes to complete the form to request for support. Next slide. Here you can see where, I mean, on the web page, the request support button. Next slide. And so with that, I'm happy to, I'm closing this webinar. It was again a really great moment to hear from the good work being done on anticipatory action and nutrition. Thank you again for your participation, and we really appreciate your time and your engagement. We wish to see you in our next webinar. It's just when you will, we will close this webinar, you will see that automatically there will be a pop-up with an evaluation form. So please take 5 minutes to answer to it. It's really important for us to get your feedback, and so that we are able to improve our next webinars, and we're able to further meet your needs. Thanks again, and have a very nice rest of the day. Bye, everyone.